Good evening. My name is Alfred Varone, and I'm going to be giving a presentation on the expansion of telehealth. The one thing before I turn the slide I want to emphasize is throughout the semester, I focused my study on Oklahoma. As I mentioned on my papers and my past presentations, Oklahoma ranks second to last when it comes to health care to its people. So I focused on the rural parts. So what is telehealth? Telehealth uses technology to be able to remotely deliver health services to those patients who cannot access physicians. Some of the services telehealth offers are consultations, health assessments, diagnoses, and treatments. Telehealth actually has been in the works for many years. Essentially, it started as something that was kind of more sci-fi, but as sci-fi will tell you, is usually when something will come true within the next 50 years. When COVID-19 happened, there was a lot of restrictions on patients. There was a lot of mandates about social distancing, which patients were not able to have the access to their health care providers as they used to. So there needed to be a plan, and that's where telehealth came in. I myself, when I worked through COVID. I worked in the ICU and worked in different sectors. I myself had to even wheel a computer and with a camera into the rooms because that some physicians, such as oncologists, didn't go into COVID positive rooms due to fear of cross-contamination with their patients that were immunocompromised. Is telehealth needed? Absolutely. I've listed some factors that make the need for telehealth very important. One, you're talking about your aging population. Two, there's a clinical shortage. Okay, healthcare is not readily available everywhere. Okay, some of us that live in major cities have no problems going to urgent care, our doctors, a specialist, the hospitals, but that does not apply to everyone. The more further you live out, the more rural your community, it is harder to find specialists. It is harder to go to the doctors, and this can present challenge. And again, I put in caps and big letters, access to care. That is the main issue. You can't access to care, and unfortunately, physicians nowadays are grouping themselves together where they're not venturing out independently. This lack of access of care causes delays in treatment. If you cannot be treated, you cannot get better. If you not get better, therefore, your chances of overcoming whatever you're going through are not very well. There's also the travel barriers. It is quite different traveling 5 or 10 miles versus 250, even 300 miles to be seen by a specialist. So those are factors to consider. Some of the ways that these telehealth consults are done is wireless tools. You have two-way videos, such as Zoom. You also have people can do it from their phone, their laptops, their tablets as well, through emails and also smartphones. Physicians are readily available. Now, the downside to this is that it is not secured lines. Therefore, there is always the opportunity that somebody can get in and actually access your care. So not 100% top secret, as we would say in the military. Why expand telehealth? Let's talk about this a little bit. Telehealth gives patients access to health education and also support from their computers and wireless devices when it comes to their health. Instead of traveling 300 miles, you can actually log in and be able to talk to a provider within the comfort of your home, and also without the stress and wondering of how you're going to make it to your appointment. You also open up the doors for more access to specialists. The more specialists that there are, the better, especially through telehealth. Also, the quality of care can be improved. In rural areas, whenever there's no specialist, people have to rely either on their family doctors or PAs to treat them. Nothing against them, nothing against the care that they do. They do an excellent job for those communities, but at the same time, they are not specialists. So, as I've seen patients being treated, for example, for their depressions, their bipolar, schizophrenia, diabetes, they don't have at times the desired results. Have they either gone to a psychiatrist for their mental health or an endocrinologist for their diabetes as well? Also, with telehealth, you have reduced hospitalizations and ER benefits, which can save a lot of money. I cannot emphasize how expensive it is to go to an emergency room. You're looking at an average of between at least $2,000 to ten to even $20,000, and it doesn't even involve you being admitted to the hospital. So that is a very pressing issue because hospitals are put their backs behind the wall because they have to treat. But at the same time, like I mentioned, nothing against hospitals, but they are a business. And when people are uninsured, it becomes an issue. What type of treatment they get, they are either stabilized and sent home, or if not, um, it ends up being a big deficit that essentially the government swallows up. Telehealth also gives both patients and providers satisfaction. Okay, being able to communicate with each other is a big step. It helps both sides, so it's definitely something for both of them to that they can relate, as well as the insurance companies, and as well because insurances can also, in a way, be able to charge less when it comes to the treatments. Physician support for telehealth. Okay, physicians are, besides being medically smart, they know this is a look at the future. This was a survey in 2010. Approximately 88% of physicians were supportive of mobile monitoring, as compared to 12%. Physicians feel they're able to keep up with their patients more. They're also able to maintain a continuity of care with their patients. And also, there is a excuse me, there is a reduction of loss of appointments. The one thing I remember going to the VA that's very prominent is a lot of missed appointments. Missed appointments is a loss. It is a loss for the provider, it is a loss for the patient, but it is also a loss for the institution. And one or two appointments doesn't, you don't think of it as much, but when it's thousands of them, this can equate to a significant loss to the institution. Well, Oklahoma agreed to funding it. Oklahoma will be able to support more of its citizens with telehealth, especially in the rural areas. Healthcare clinicians will see this as an opportunity to render care throughout the rural areas without having to travel to them. There's also will be a reduction of hospital visits, especially in the ERs, which can also decompress the ERs, which right now are completely being swamped by a lot of. From experience, I will tell you that a lot of the emergency room visits tend to be stuff that can be handled by either telehealth or just seeing your physician, but people come to the ER because they actually have no other alternatives. Here are some sources that I got my information from, but if you have any questions, please feel free to email me. It has been a wonderful journey taking a look at the great state of Oklahoma and seeing what policies can better it. I do believe the expansion of telehealth is a look at the future. It can actually put Oklahoma on the cutting edge of healthcare and definitely improve its numbers and bring it from the bottom up. Thank you.